Hi, everyone. Good afternoon. Let's give it another minute to see if a few more people trickle in. Madeline.
Yes.
I'm looking at the PowerPoint and I'm not seeing the little button to start the presentation. Can you help me?
In the Zoom window or in the PowerPoint window?
In the PowerPoint.
You could try going from, because you know how there's like the file tabs as well. Instead of using the one down at the bottom, you could try using the one, I think in PowerPoint, I can't remember, but you go over in the tabs to like view or something, and then you have the option to present from there. I could open up PowerPoint here and see.
Yeah, that's not doing it. Isn't there like a start presentation? I've always had that.
Do you have a bar across the top of your screen, like a yellow bar that says like enable like sharing or something like that? Sometimes my PowerPoint opens and it has a bar, like a little yellow bar across the top, and I have to select that first in order to do some of the other stuff.
Are you able to get it going? Maybe we'll just have you share your screen and I'll tell you when to go to the next slide.
I am trying to do the breakout rooms right now, so perhaps maybe Susan, I don't know if you would be able to share screen with the PowerPoint.
Whoops.
Okay, wait, I got it.
Oh, you got it?
Yeah.
Okay, great. Otherwise, I was going to say I can help you out.
Well, I kind of got it. Okay, let's get this started. We have a lot of people here. Awesome. Are we ready to start, Madeline?
Whenever you are.
Okay, great. Welcome, everyone. I see everybody's already doing the thing that I didn't even ask you to start doing. My name is Maria Perez. I am based in Santa Fe, New Mexico. I'm really happy to be here with you today. I run an organization called Democracy in Action, and Susan Wilger and I have been working on a series of trainings for the health councils for the next several months. We'll have one training per month to just give you some additional tools and skills that you can use in your advocacy in your health council. So this is the first of the series. We're doing a training today around storytelling, around using storytelling for advancing your advocacy efforts. So if everybody can just put in the chat your name, which health council you're here representing, and if you want to share, no, you don't have to, but if you want to share one thing that brings you a lot of joy that you do outside of your work on this stuff. So let's start with that. And let's see what we got. Luna, Coy County, Metro, Grant, Otero, awesome, Bernalillo. We have a lot of people here from different counties. McKinley. We have some folks from DOH, Health Promotion. Thank you so much for being here. Somebody likes to bike to work. Eating from my garden. I like doing that too. Okay, awesome. So I'll let you all do that a little more. Everybody is aware that this meeting is being recorded. I'm going to share my screen and we're gonna start this presentation. Hopefully we'll have no technical difficulties, even though I already encountered a couple. Okay, let's see. Slideshow. Here we are. Can you guys see that? Thumbs up?
Yes. Yes.
Okay, great. So let's start with what we're going to be learning today. We have a 2-hour meeting. It's going to be jam-packed. We're going to be doing some learning, but in other words, I'm going to be telling you some stuff. We're going to be doing some stuff together. You're going to be doing some stuff in small groups, so it's going to be very interactive. We're going to start our meeting today just talking briefly about what is a story and why stories are so important. Then we're going to talk a little bit about the science of storytelling, like the kinds of emotions that one can elicit using a story and the kinds of responses that you get from your audience when you elicit those emotions, and how to work with that when you're drafting a story. Then we're going to get into our first round of practice session. You're going to be coming up with a very quick story that you're going to be sharing with your small group members. Then we're going to come back to the big group and learn a little bit more about the difference between sharing a story versus sharing information, what it means, how it works, what's more effective, and when do you want to use each approach. With that learning, we're going to go back to small groups and retool the story that you worked on during the first breakout room to craft it a little bit better. Then we're going to come back to the big room and we're going to talk about framing. In other words, how to make sure that you are tailoring your story to the audience that you're telling your story to. We're going to go back and practice, really like polish our story at that point. And then we're going to come back and briefly talk about a tool that many of you may be familiar with already, which is story banking, right? How to collect a bunch of stories from your advocates, from your community members that you can keep in a library, if you will, for use as you need it to, when you need to talk to decision makers, when you need to get some messages out to your community. So how do you story bank and what are some tools that you can use for that? And finally, we will close the meeting. There'll be an opportunity for you to work together. There'll be an opportunity for you to ask questions. If you do have questions, please use the raise hand button on your Zoom, or you can just put it on the chat as well, and we'll be trying to monitor those as well. So let's get this started. Okay, so what is a story to begin with, right? From the beginning of time, ancient cave paintings and petroglyphs, we have many of those petroglyphs right in New Mexico, to modern day stand-up comedians or TV shows or whatever it is. Humans just really use stories to communicate with one another, right? We like to listen to stories. This is how we find connections with one another. All of us are very good at receiving stories, right? We like to receive stories. Back in the day, also families would gather around the radio and listen to those radio dramas. This is all storytelling. This is how we relate to each other. We're wired to tell stories and to receive stories. Now, all of us love a good yarn, right? We love to hear a good joke. We love to hear a good story, but many of us feel like we're not equipped to tell stories. That's for writers, that's for people who work on TV and making shows or whatever it is, but that our stories are not really worth telling, or that we don't really know how to tell them. But I'm here today to change your mind about that. Everybody is a great storyteller, because basically all we do all day, every day, is either tell stories or listen to stories. So we have a lot of practice in this. With that, we're just gonna break right into our first breakout room. So Madeline is gonna break us into groups divided by region. Basically, there's gonna be several people in each group. And what I want you to do in each group is just each person individually in your group just spent about 3 minutes thinking of a story, right? And what I want you to think about is something that your health council has worked on or has prioritized at some point in time that that is of special interest to you personally. Maybe you have some sort of personal story associated with it. I'll give you an example. Let's say that my health council was doing some work around diabetes awareness, and they put together some cooking lessons for folks, families dealing with diabetes, so that people could come and learn how to take better care of themselves. So this is a story that has impacted me personally, because my mom has diabetes, and I signed her up for us to go together. And this was a really transformative opportunity for us. We got closer together. We were able to change the way that our family prepared meals together and shared meals together when we got together. So this was important to me personally. So I'm going to write a story about this. So for you, whatever it is that has happened in your health council that you have a personal connection to, I just want you to think about something, and I want you to write down a few notes about it, right? Like, what is the thing? Why is it personal to you? Why is it important to you? Sort of like, what is the story there? And I want you to draft that story from the point of view of a character. So you're telling it as a story, okay? So take about 3 minutes each to think about that. And then Madeline will send a little reminder to your breakout room to when it's time to wrap up that part when you're working individually. And then you're gonna share, a few people, and you just volunteer yourself, will share the story that you're coming up with the other members of your small group. And I want you to share really briefly in like a minute or less. And for those listening, just pay attention, right? How does the story make you feel? What parts of the story kind of hook you into what's happening? What parts of the story are losing your interest? And what did you learn about the person that's telling the story? So Madeline, let's go ahead and break people out. I will be jumping, and Susan also will be jumping from room to room to answer any questions and make sure that everybody knows what they're doing and has any additional support that they need. So let's go to that.
All right, I'm going to go ahead and open the breakout rooms. You should get a prompt on your screen, and if you don't, there's just a few people left over, so I'll just check in with you and see which room you want to go to. I'm going to open the rooms up now. And if you're left here in the main room and you haven't seen a prompt on your screen yet, you should be able to self-select into a breakout room if you want to by choosing breakout rooms in the bottom of your screen, or you can let me know and I will point you towards one of the rooms. Oh, here's somebody else joining. And Sarah, I see that you're, oh, okay, she got there. Hi, Rebecca.
Hi, how are you?
Rebecca is one of our interns, Maria. If you are welcome to do kind of however you'd like to. There's like different people in each of the rooms. So if you want to just join one and kind of listen in and participate however you would like to, you're welcome to do that. Otherwise, you are also welcome to, however you would like to do.
Well, I'm here if you need any help too. If you need me to do anything, let me know.
I'm having technical difficulties still because now I can't get back to the full Zoom. Like I only see me and Madeline in there in a tiny little window.
Do you want me to send you to one of the breakout rooms, Maria?
I would like to be able to jump from one to another, but I need to get back to the Zoom in a way that makes sense.
I think if you choose stop share from the top, it might be easier.
Okay.
And then I also
Oh, yeah,
just
there it
want to
is.
say hello to Shelly and Vanessa, who I see just joined. We just joined some regional breakout rooms. We're just kind of doing some story sharing. So I'm going to send you all over to those rooms for your region. You can kind of just join in with the group there. Just a
Thank
moment.
you.
Yes.
So do you want to send me to whatever room and then I'll come back and you send me to another one?
Sure. Yes, I can do that. And you can also use the bottom. If you want to go in by yourself, you can also do that on the bottom toolbar.
Oh yeah, breakout rooms. I'll do that.
Okay. And
Okay.
Vanessa, I see you just joined. Is this Vanessa Gomez or which Vanessa am I?
Yes,
Vanessa?
I'm sorry.
No
Yes.
worries, no worries. That's perfect. I will send you over to your breakout room.
Thank you.
Yes.
You did it.
Yay.
Now you.
Did you want to share something? All right.
Hello, everybody. Can you hear me? Hi,
Yes,
everybody.
I can hear you.
Okay, it's Michelle Pacheco.
Michelle,
Yes, hi. Hello,
tell
everyone.
us.
I was in the Northwest Health Council room, and yes, I heard a story that resonates, I believe, statewide, especially in our frontier rural areas, where it's a huge challenge that even though you do have some resources, they are limited. And it's always challenging when you don't have the same provider each time you go, because there's always a trust issue. There's virtually no dialogue. You have to repeat oftentimes, especially where elderly folks are concerned. And you tend to lose over the visits what might really be happening. So it's a huge issue. And part of our problem is that how do you measure access? You know, and some of the reports we're obligated to address, that's a huge thing statewide. And how do you really measure other than, you know, the story behind the data? What does the data reflect in terms of services in these areas? And then what do the stories behind the data tell you about what is happening in these areas affecting our everybody, really, our elders, our youth. So that's what I'd like to share. So I found that engaging and wanting to address it from my level. Thank you.
Perfect. So that's great, right? And your point about how do the stories sort of back up the data, right? That's exactly where we're going to get at, because people can receive and absorb a story way more than they can receive and accept data. So having the story be engaging is going to have them be open to looking at the data and paying attention to it. So Michelle, what I'd like to challenge you with is like, okay, great. How can you tell a story about that is like a personal, something that is personal to you or to someone you know? Maybe you have an elder in your family that has experienced these kind of barriers. What is that story like, with a main character and like a plot? So think about that as we keep going through the training today. Doreen said in the chat, says it piqued my interest when she said this story was told by elders. Doreen, do you want to expand a little bit on that?
Yes, since it was Sarah Bitsui that shared, was starting to share a story. And when she said it was told by elders, I knew it was important, and it's cultural knowledge that I wanted to hear more.
Excellent, excellent. Thank you, Doreen. Anybody else wants to share either a little bit about what story you want to share? Andrea, let's hear from you.
Gracias.
So I am sharing a story at the farmer's market, and anywhere I can get a microphone, including on the radio this morning in the village of Ruidoso, about this symbol that teaches us 4 obligations: a strong body, a clear mind, a pure spirit, and a community obligation. And the woman that just spoke about, she wanted to hear what the elders had to say, and that it had this cultural value to it. And in 2013, the word culture was the #1 looked up word. And I feel like the reason we have all these problems, it's our cultural relations. And I feel like this could heal some of that. And my story is to my legislators, it's to the citizens, it's our heritage, it's to you, the Health Council, that we can change these problems by learning about the symbol through song and dance. Thank you.
Wonderful. And is it Andrea or Andrea?
Both. I like Andrea, or in Espanol, Andrea, but the other one's not so much.
Okay, well, I'm going to call you Andrea because I love that name. So
Gracias.
Andrea, that's beautiful, right? Like you have a real focus and clarity about what you want to share. What I want to push you to do during this training is to make that your own story, that you can tell it. This is how I've approached these 4 basic tenets, or whatever it is that you call them, or this is how I've seen my elder or my community member or my son or daughter do this, and how it was transformative for them as an individual, as a personal story. Okay.
Okay, so I would like to do it from a fictional superhero named Apple Blossom.
That's fine, as long as it's a character that we can connect with. Okay.
Okay, great. Thank
Awesome.
you.
Let's have one more person that wants to share. Elsa, let's hear from you.
Thank you. I will share this story. I'm borrowing this story. So this girl at age of 13, Jessica, started struggling with addiction. She got not a second, but a third chance for recovery, thanks to having access to an Narcan. Now she's over 35, and she's an advocate for people on long-term recovery. And she calls herself Narcan Lady on TikTok.
Thank you, Elsa. Perfect, right? We have a character. She was facing a struggle. We can sort of relate to that. And then there's like the sort of like a happy ending, right? She got the support she needed, and now she's an advocate, right? So this is like an arc. We start with a person. There's like a struggle. There's some sort of issue that needs to be dealt with. It could go either way, right? And then it got resolved in a positive. So excellent, excellent work. Okay, cool. So let's keep going with our training. We're gonna go back to our small breakout rooms 2 more times to keep sort of tinkling with your stories. But for now, let's learn about some other stuff here. Let's see. Okay. Let's get to our, okay, so now we're gonna learn about how storytelling affects your mood, right? We have already covered that we all love stories. That's how we connect with each other. We tell stories, we listen to stories. We use stories to convey what's important to us, what we want others to know about us or about something that we care about. So now we're gonna go over a little bit of science, if you will. There are brain chemicals that get released in your brain that affect your mood, right? And these are released when you feel a certain emotion. So as a storyteller, having information about this is very important because you can use this information, right? If you elicit a certain kind of emotion with your story, you're gonna get a certain kind of response from your audience. So if you know what kind of response you want from your audience, you can decide how you want to tell your story to elicit that emotion. So let's go over a couple of these brain chemicals. So the first brain chemical that we're going to talk about is dopamine. Dopamine is the chemical that gets triggered when a story leaves us hanging, right? When there's a cliffhanger. This is something that if we watch TV, if you guys like to watch TV, this is good TV, right? When the episode ends and you're like, oh my God, what's gonna happen? And then you get to binge the next episode. This is dopamine getting released in your brain. Dopamine, when you get this cliffhanger, as a listener, the dopamine makes you know what's gonna happen next. You're invested in the story. And as a listener, you become more focused. You have a better memory, like you want to remember everything so that when you learn what happens next, like you're engaged. And it gives you more motivation to be in the story. So this is a great emotion to elicit, right? This is a great tool to elicit when you're using storytelling, is to build in a cliffhanger in your story, even if it's just a little tiny thing that makes your listener want to know more. You build suspense, you launch a cliffhanger. So I'm going to give you an example using that example that I started with my mom having diabetes, right? And the diabetes awareness work that my health council was doing. So a couple of days before the first cooking class, my mom had her birthday, and my mom's favorite thing is sweets, and she got a tres leches cake for her birthday. And nobody was paying attention too much, but she ate a couple of slices and her sugar levels went so high that she started getting really confused. Her eyes started looking kind of like glossed over. And then at one point, she wasn't really recognizing her grandkids, and it was looking like she was gonna faint. So we were really concerned. We called the ambulance. They came to take her. And that was, she got taken away to the hospital on her birthday party. Okay, you guys want to know what happens, right? So I built in a little bit of a cliffhanger there. Dopamine has been released in your brain. And now you're like, oh my God, what happened to this mother? I want to know more, okay? That's a tool, easy peasy, you can use that. All right, let's look at the next chemical that we're going to talk about is oxytocin. Oxytocin is the chemical that gets triggered when a story makes us care about the main character, right? And I used Homer Simpson there because Homer Simpson is, he's kind of a loser in a lot of ways, right? But we all love Homer Simpson. We can relate to him. He cares about his family. He cares about his kids. He's trying to do right. And even though he is not a hero in any way, we relate to him. We are rooting for him. We want Homer to win, right? We want Homer to succeed. So this is what oxytocin does. How do you release oxytocin? You just figure ways to make your character relatable to the person you're talking to. And oxytocin makes you more generous. You feel more open to accepting the story, the character that you're hearing about. It makes you want to trust the character that you're hearing about, and it increases your desire to bond with that character. So I'll give you an example again with the diabetes story. So my mom got to the hospital and her sugars were so high that the doctor told me that she almost went into a diabetic coma. When I finally was allowed to come in to see her, she was crying and she was telling me that she had embarrassed herself by being confused and almost passing out in front of her grandchildren. And she was really scared about dying. You're feeling for my mom, right? And you're probably feeling for me also. You want things to work out for her. You want her to be able to like figure things out because she's scared, and like just the thought of an old woman being really scared and really embarrassed, it makes you feel for her. It makes you relate to her. That's oxytocin. Your brain, that's where it is right now. So again, that's an easy thing to elicit. Now we're going to talk about endorphins. endorphins are the chemicals that get triggered when we laugh, when we find something funny or delightful. Laughing makes the listener feel more open, more relaxed, more creative. And it makes people be more able to focus. And we all know that laughter is really great medicine, right? We hear that all the time. So, and we connect with each other. If we make somebody laugh, we're connected immediately. So let me just give you an example of how to add a little funny something to the story that I'm telling you about my mom. So when my mom was released from the hospital later that night, it was still her birthday. And I took her home and I asked her if she needed me to stay with her. And she said no. So I just went home and checked in with her the next day. And the next day, I realized that she had gone back to her tres leches cake and she had cut it up in little 1-inch cubes, which she had put in the freezer, individually wrapped, so that she could just get one and thaw it out and eat one little tiny piece of cake and still have what she liked, right? But like was very careful about it. And so I told her that she was crazy and that I couldn't wait to start the cooking classes with her because I could tell that she was ready to make some changes in her life. That wasn't even a joke, right? That was just a little funny anecdote, but it made you smile. It made you feel like, oh my God, that's so funny. And that there you go. We're bonded now. You feel more relaxed, you're focused, you're attentive, you want to know what happens. So these are the chemicals that you want to keep in mind, right? The emotion that they elicit, you want to keep in mind because you can do things to your story to make sure that you elicit those emotions, to make sure that you get the response that you want from your audience when you're advocating. I want to go over one chemical that you absolutely want to avoid when you're telling a story, which is, cortisol and adrenaline, two of them. These are the chemicals that are released when people are stressed out. We know how this feels, right? These chemicals make people more irritable, more rigid, more intolerant, more critical, and it decreases their capacity to pay attention and also to remember what it is that you're talking about at a later time. This is a lot of times when people are advocating for things right in their community, this is the kind of response that they go for, even though it's the worst thing you can do. It's not a good tactic, but usually you want to say, there's, like heroin is a huge problem in my community. We're having so many people die from it. Like families are broken. By then, your audience is feeling stressed out and they don't want to hear about it anymore. They want to go to lunch. They want to forget about what you're telling them because they just feel hopeless and stressed out and there's nothing they can do about it. And they shut off, right? They become closed to the conversation. So keep this in mind because oftentimes this is what people think you need to elicit in order to get a response from your audience, but it has the opposite effect. So I'll tell you an example from my mom's story. So we go to the first cooking class, right? And the community health worker that's leading the class starts by telling them a warning. She says, diabetes can and will kill you. It is one of the leading causes of deaths for adults in the United States. Diabetes deaths are horrible. They include kidney failure, where you have to get on dialysis, and you can never recover from that. You're lucky if you can get a kidney transplant. Your toes will start rotting away, and you will need an amputation. Your heart will stop working properly. You are likely to get dementia, and it will be a huge burden on your family if you get sick and then die. Diabetes is no joke. Okay. That stresses everybody out, right? That stressed everybody in the class out, like nobody wanted to be there anymore. This is not a productive conversation. Okay, so having learned this, we're gonna go back to our small groups. And I will start with the last group that I went to last time and work the way backwards so that everybody gets enough attention. But what I want you to do is to, again, spend about 3 minutes reworking your story. You can just count yourselves off 1, 2, 3. You can do this alphabetically by your last name. There's kind of a lot of people in some of the groups, so you can do this however you want, but I want you to assign yourself a number, either 1, 2, or 3. All number ones will look at the story that you were beginning to think you want to tell and figure out how to build in some suspense, right? How to throw in a cliffhanger in there. People with number 2s are going to make their main character more relatable. How do you get the person that is going to be listening to your story to really care about that character, to really root for that character, okay? Just what can you add that's just a little addition? And the person with a number 3 is going to figure out how to build in a little joke or how to just put in a little funny something in your story to elicit those endorphins, okay? So let's go back to the rooms. Everybody can take about 2, 3, 4 minutes reworking your story to add these elements in there. And then we'll switch over and a few people can share, and the people who are listening can pay attention and see what changed, right? How's the story make me feel? What did I learn about this person? Do I want to learn more or not? So let's go to our breakout rooms, and Susan and I will be making our rounds to support you there.
Maria, which room are you going to? Or did she already go? Oh, she already left. Never mind.
I can tell you which room she's in, I think, though. Let me just check here.
Okay.
It looks like Maria's in the Northeast region right now.
Okay. Thanks.
Yes.
Go to. She's in the Northeast, so maybe I will start with Metro.
Crystal, I see you are just joining. We're just getting out of some breakout rooms here and we'll kind of come back. Oh, I don't think she can hear me yet. Hi, Crystal. I see you're just joining. We're just getting out of some breakout rooms here and we'll kind of come back to the full group and then we'll have one more round of breakout rooms here during the meeting, just to let you know where things are at.
Okay, perfect. Thank you.
All right, it seems like most people are coming back. How was that? Does anybody want to share how that went? How you thought about your story in a different way and adjusted it a little bit to add one or more of the elements that we talked about? Who would like to share? Mona? Go for it. You there, Mona?
I don't know if my mic is working. Can you hear me?
We still can't hear you, Mona. It sounds like you're still having those audio issues.
Yeah, but can you hear me?
Sort of.
Audio problems.
Mona, try turning off your video and just using the audio. We're in McKinley County, so we have a lot of issues with connectivity. So maybe just try turning off the video and just turning on the mic. Just leaving on the mic, but turning off the video should work.
She did try that and it really didn't help a whole lot. It's a great idea, Chris.
It might help further if everyone turns off their video. That sometimes helps, you know, and really, it just depends on the computers too as well.
Let's see, Mona, try again.
Can you hear me now? Any better?
Better, yeah.
Is my voice coming out better?
The voice is
No.
better. Everyone try turning off the video.
Okay, I'll just listen.
Mona, or you, if you want, you could put it on your thoughts on in the chat and I'll read them out loud.
Okay, thank you.
All right. It's too bad because I would love to hear from Mona, but is there anybody else who wants to share either how you were able to add those elements to your story or how somebody else shared their story with an added element and how that changed it or how that hooked your interest and attention? Anybody? Come on, you guys. Somebody must have something to share.
It looks like Anna.
Oh,
Anna, let's hear from you.
Okay, thanks, Maria. Yeah, just really quickly, it was really helpful to reconceptualize the story and have those 3 points to build in. And it also has me thinking that you talked about, let's not stress people out with the stories we tell, and thinking about why is that our inclination, right? That's our inclination is to go in front of people and say, oh my gosh, sound the alarms, you know, people are dying from heart disease at astonishing rates, and it's people of color in these neighborhoods, and we got to do something about it. Why is that our inclination? And this other way feels really different. And I really appreciate incorporating these pieces. And we did have in our group somebody share a story about resistance they had in a small community from some leadership to doing vaccine clinics. And they wove in some of those pieces about this person was resistant, and that felt like a cliffhanger, like what was going to happen were they going to let them? And I definitely was more engaged listening to the second story than I was, even though the first story was really engaging, than I was to the first story because of that added element.
Thank you so much for sharing that. That's exemplifies everything that we're talking about, right? And as far as your question is like, why is that our inclination to stress people out? I think the main reason for that is that we as advocates, we really care about these things. We have looked at the data, we understand the urgency, and we are stressed out, right? So then we want to make other people feel the same way that we feel because we want them to take action, but that actually doesn't work unless the other person is also already very invested in the issue that you're trying to work on. If you're just trying to talk to somebody and get them, get them in the door a little bit to open up the conversation, stress is going to make them run away, right? So it's sort of like we're going to get into this a little bit when we talk about framing, but it's the cross to bear for the expert, if you will. If you think about something a lot and you want to convey it to somebody who doesn't think about this a lot, all the brilliant things that you have to say and the things that you want to share with them are going to have the exact opposite effect when it gets into their ears. Like it's going to go one ear and out the other, even though to you it makes perfect sense and it's a beautiful thing that you're trying to share with them. Michelle says, always helps to base stories on reality with data, and in many of our areas, perceptions are quite strong. That is very true. Okay, one last person, if you want to share, either about your story or about a story that you heard in your group.
Maria?
Go ahead, Evangeline.
No, you go ahead, Lisa, because I...
How about we make room for both of you? Let's start with Lisa.
I agree with Anna. It was really hard we were talking about a very important thing, something that's not warm and fuzzy at all, and then trying to turn it around into something that could make you smile, even though it worked. The project worked really well and everything, but still when you're in the story, it just didn't come off as enlightening or more lighthearted than it should have been. It was kind of dark. So it was good to try to practice that and try to make things more positive.
Excellent point. And also, if you're talking about something really dark and hard, right? If there's a lot of suicide in your community, like you can't make a joke about that, right? Like that's not appropriate. But also you want to make sure that you're not stressing out your audience to a disproportionate level. So maybe you can just say something that will make them smile that is not even related to that thing, but just that's going to change their brain chemistry for a second so that they're more open to receiving the information, even if the information is very, very dark. Mona says, thank you, Mona, for putting it on the chat. Mona says, homeless looks out for each other. One lady sees the bus and wants us to go to the camp where there is someone that cannot walk so the person can get food. So this is a story about like solidarity, it seems like, right? With the homeless folks. Thank you, Mona. And let's go to Evangeline. What did you have?
Oh, well, I was in Lisa's group and it was her story, but it was a good process to take because it was a dark, outcome, but actually the outcome was that the health council got involved to pass out testing strips. I think that's what they were, strips. And so it was a good challenge for us to try to turn that into more, not using all the dark pieces there. So I enjoyed that Lisa, helped us process that with her story because there had been a death with fentanyl use. So it was very much a challenge for us, but we did somewhat transcend it into those elements that you talked about.
Perfect. I love to hear that. Okay, any last minute thoughts before we move on to our presentation? Diana says, love that this training is based on good body brain science. We try, girl. Okay, I'm gonna share my screen again. And we're gonna continue here. Okay, let's talk about telling a story versus sharing information. This is another pitfall that advocates get into all the time. We feel compelled to bombard our audiences with data points, right? We have the percentages, we have the statistics, we have the infographics, and we, right, because we think about this stuff all the time, we have meetings about this, we talk to other people about this, like our brain is like well primed to receive that data and those data points and that information and those statistics. But that's not the case for other people, right? They are not, their brains are not ready to receive an onslaught of data. You need to prime that up with a story. So let's remember that ultimately, as you can see, oops, sorry. As you can see on the slide, advocacy ultimately is just telling stories so that people will take action, right? Other people will take action because of your story and not because of the information that you share with them. The information that you share with them is super important, and it supports and builds up around the story that you tell them. But what they're going to remember is the story, right? What's going to hook them to want to pay attention and learn more is going to be your story. So I'm going to give you a quick example about story versus information, okay? So I'm going to share with you two scenarios. Let's say that you're on Facebook and you see a story posted by someone you know who tells how a young family member of theirs has harmed themselves because they were bullied so much at school for being overweight. This person talks about how devastated the family is and how they wish they had sought help for their loved one before this horrible thing happened. Then they share a 1-800 number for a suicide prevention hotline and ask that if you're reading this, that you tell your loved ones that you love them and that you know that they're struggling, and to be proactive in ways that you can support them. That's one scenario, right? The other scenario is you are again on Facebook and you see an ad that comes up on your feed for a suicide prevention hotline. It lists a 1-800 number and has a tagline that says, if you're struggling with anxiety or depression and need to talk to someone, we're here for you. One is a story and one is just information, right? Let's talk about which was more effective and why. Who has something to share about that?
This is Alicia with Lincoln County, and I definitely felt more strongly towards the first story. It definitely pulled on my heartstrings and made me really feel for those people. I feel like a lot of people can connect with the idea, hopefully not the reality, of losing a child and how horrific that would be. And so I feel like not only was it extremely relatable, but it really made you feel something very strongly.
Thank you. Thank you so much. Anybody else want to share anything about how that landed with you? These two scenarios?
I can share. This is Doreen.
Go
It
for
was
it, Doreen.
interesting, though, that I actually liked the second one because it said, we're here for you. So it seemed like it spoke to me personally, like somebody's there for me.
And that's an excellent point, right? If I am the person that's looking on Facebook and looking at these posts, right? If I am currently struggling and need help, that second one might be more helpful because it's like very easy, right? It has a phone number and it says, we're here for you. I might call that number right then and get the help I need. But if I'm not a person that's currently struggling with suicidal thoughts or anything like that, that second one really won't do much in terms of like, if I have someone in my family that I think might be struggling, or my neighbor I think is having a hard time, just seeing an ad with a 1-800 number and that tagline is probably not going to move me to reach out to them and say, hey, how are you doing, right? As much as the story that the first person shared, where it's actually a story and it pulls on the heartstrings. But absolutely, both scenarios have a utility. It's just, who are you trying to reach? What's the broadest reach that you're gonna get? And what are you trying to achieve? Good point, though. Anyone else want to share anything about story versus information?
I'm just struck by how I think there's not a pressure, but oh boy, how do I say this? Like there's an ethos about being sanitized from a health council point of view. So when we're putting information out from a very public, very, not just me on my Facebook, but representing a group, I felt the pressure to pull back and not be, and I'm going to use a word here that might be controversial, but not be manipulative with some of those tactics as a representative of a health council. Like if I'm all hot and angry about a topic on my personal Facebook, that might be one thing, but from a health council point of view, I know that some folks might be hesitant to go on that more emotive route. I don't know if I'm saying that respectfully or not. I feel like I'm not, but I think I want to bring it up just because, like that on branding thing we talked about last week, like making sure that you're sticking to the plan of a communication platform or plan. I think it's just really important to keep close to our minds.
Thank you for that, Diana. I see that Michelle has her hand up. Let's hear from you, Michelle.
I just think with all the challenges our health councils statewide are facing, I do believe that the approach should be both. They should, in any story, to funders and to their neighbor, to anyone, I think part of it should be the advocacy, telling that story so that people they're telling can take action, and try to reach those because of the information they're sharing, they'll take action. I don't see why it has to be limited one or the other. I think with great storytellers, and I think of Jerry Montoya, for example, you can do both, and both extremely well. So that's my take. Thanks.
Thank you, Michelle. Let's hear from Christine.
Well, I was just going to say, I think everybody's points are really great, but I think in particular, your example of the story that actually was followed up by an action message of what to do is one of the ways to go about it. And I mean, from communications research also, I mean, a lot of times it isn't just enough to give a story, because that can be seen as one kind of instance. If you can back it up with a little more in the sense of, you know, some data that gives an idea of how widespread that problem might be, for example, that it's not just one person we're talking about here, it helps give context. But the other thing I was going to say in terms of Diana, I would hope that wouldn't happen, because to me, it seems like in public health, a lot of what we are trying to do is move people toward behavior change. And to move people toward behavior, you need to, in a sense, motivate them. And I wouldn't think of it in terms of like manipulation as much as we do need to use some maybe persuasive tactics, but not like they do in commercial marketing or anything, but we can learn from that as to how to use that motivational kind of piece to help move people there. And it's just, again, I think as Maria is trying to point out, it has to do with the kind of framing of our messages, how we put it together and put it out there. Yeah.
Thank you, Christine. And yeah, to speak to what everybody has shared, and thank you so much for stepping up and sharing your thoughts about this. It is advocacy is a huge endeavor, right? There's like the advocacy, the messaging around advocacy that comes from the entity, be it DOH, be it a health council, be it the office of the governor, whatever it is, right? And those, that kind of messaging, of course, needs to be more dry, more professional, more sort of data driven, right? Like you're not really, that's not the place, right? For a lot of personal stories and like really getting emotional about stuff. But as an advocate, as an individual advocate, when you're talking to an individual other person, be it a state representative or another member of a community or the president of a hospital or whatever it is, you're having that one-on-one conversation that's relationship building, that's absolutely based on an emotional connection, right? So you just have to navigate these things. Like, who is your audience? Who are you? Are you just talking as to somebody as your own self? Are you representing your organization? Like, you have to navigate, figure out how to frame it, as Christine is saying. But it can absolutely, like Michelle was saying, be both things, right? You can be very much on point on the data, and when appropriate, you can very much lead with a story, and that's kind of what we're talking about today. Cool, excellent. So let's, I'm gonna move us to the next slide, and we're gonna have a little cheat sheet, if you will. In practical terms, here are some reminders for you when you're figuring out what you want to say to a decision maker or a community member or anyone else that you want to engage in your advocacy efforts. When you make the time to talk with someone about your efforts, remember that you usually have like a minute or 2 or 3, right? Unless it's like a friend or somebody in your community that you can say, let's go have coffee, and maybe you can talk for an hour with them. That's different, right? But if you make a meeting with your state representative or with the head of a department or something like that, you're going to have about 2 minutes to make sure that they're engaged. If you miss that opportunity, it's gone. You can't make up for that. So you will have to use that first or 1 or 2 minutes really wisely and make sure that you engage them at an emotional level using the tools that we've learned about today. You will either win them over or lose them within the first couple of minutes. So you have to elicit that response right away. And the way to do that, as we have learned, is to start with a story, and ideally your own story, where you say, right, what I mean when I say your own story is that you can say, you know what, I know this woman in my community who this is what happened to her, right? Or you can say, you know what, I was, you know, at one point in my life, I was struggling with addiction, and this is how it happened to me, and this is how I was able to overcome that, right? That's powerful stuff. Much more than if I say, you know what, addiction is a big problem in my community, and you know, 30% of young people have tried X drug by the time they're in the 8th grade, and it's a problem. Like, that doesn't really elicit an emotional response. Once you connect with the person you're talking to on an emotional level, then the door opens, right, to have a further conversation, to follow up with them. This is the time, right? If you are able to make that emotional connection, this is the perfect time that door opens for you to give them that infographic, to hand them that information sheet, that 1-pager that you have prepared on the issue that you care about, that tells them the data, right? That tells them that those statistics. Once you, you know, I can guarantee you that the chances that somebody will look at your infographic or at your fact sheet is going to be almost zero if you don't make a connection with them at an emotional level, right? If you lead with the infographic and say, I want to talk to you about this, please take a look at this. This is very important with my community. I will call you in a week. They're not going to look at that. It's going to be in the pile of stuff that somebody gives them. But if you lead with a story and the story connects with them on an emotional level in a way that you want, the chances increase tremendously. Then they're going to be some hours later, after they talk to like 10 more advocates, they're going to be looking at the stuff people handed out, and they're going to look at your infographic and they're going to say, Right. This was the woman from Otero County that told me that story about this thing, and that was really moving. I'm going to pay attention to this infographic. So this is only going to happen because they will remember you and the story that you told them. Okay, let's talk a little bit about framing.
Yeah, before we go there, Maria, Joyce says in chat that those stories may not belong to the health councils, but be shared with them with permission, with the point being, if you're sharing someone else's story who isn't yours, make sure to ask them for permission.
Absolutely. Always ask for permission if you're not telling your own story. And as much as possible, tell your own story, because that's going to have more impact. Okay, so framing, Christine was talking about this a little minute ago. Framing is basically the choices that we make regarding what we say to someone and how we say it. So we've talked thus far about sort of like the tools that you have regardless of who you're talking to, right? You can figure out how to make a story more funny. You can figure out how to build in a cliffhanger. You can figure out how to not make a story super stressful, right? These are across the board tools, regardless of who your audience is. Framing has to do with your audience. So it has to do with, okay, who are they, right? Am I talking to a community member that has had, that has a lot of members in their family struggling with addiction? Am I talking to my state representative because I want them to do something about this? Am I talking to the new director of the clinic who is coming into this community without any context about the history of addiction in this community or the impact it has had? So when you think about your audience, who they are, what they care about, what they're coming in to this conversation with, do you share values? Do you share cultural context, right? This is where framing comes into play. And then you figure out, okay, because of what I know about this person and who they are and what they care about, what am I going to emphasize about this story? What are they likely going to care about, right? Because maybe I really care about, like addiction from a point of view that I have had a family member overdose and die because of heroin or fentanyl or whatever. But maybe they haven't, right? Maybe they care about it because they care about children growing up in homes that are whole, where like nobody's in jail or no parent has passed away from drug addiction. I don't know. Thinking about what they care about more than like what you care about, right? Where do you meet? Where do your values meet? We also talk about, in framing, we think about how and what we explain, right? Maybe there's somebody who you think might have zero context about what you're trying to talk about. Like maybe you're talking to your state representative who knows nothing about the work of the health councils. You might want to explain what the health councils do a little bit, right? But if you're talking to Senator Ortiz y Pino, like you don't need to explain that. He's been working on this for like 50 years, right? So how you're going to explain what you're going to explain and what do you actually need to explain to this specific person that you're talking to? And importantly, also what you leave unsaid. There are things that are going to resonate with some audiences and things that are not going to resonate with some audiences. So you want to make sure that you share the things that are probably going to land well and pique their interest, and leave out the things that are going to turn them off. And that's going to be different depending on who you're talking to. The main framing problems that we run into is, as I was mentioning before, that you think about this all the time, and the person that you're talking to maybe has thought about this once in the past 3 years, right? So when you give all the information from the frame of mind that you're in, that this is super important, that you think about this all the time, that you're an expert in this issue, it's likely to go in one ear and come out the other ear. Like that graphic on the slide shows, you're talking about a circle and what they're understanding is a square. That thing that has, there's a typo there, the mistranslation problem, right? The thing that you worked and that was so brilliant in your own head as you figured out what you were wanting to share has the exact opposite effect for the person that you're trying to reach. So these are framing problems. I want to share with you in terms of framing and just kind of putting it all together, what we've learned today, a study that was done in Alberta, Canada, where there's a organization that is trying to do programmatic work around addiction and harm reduction programs. And they were having a really hard time getting the community to care about these things. Like they didn't know why addiction was a big problem in their community, but like nobody seemed to care that much. So they did this study about this and they tested 3 different frames, right? One was interdependence. So their messaging around this interdependence thinking was, we are all connected, you know, we all succeed only if the lesser of us is able to also succeed. We need to do a better job dealing with addiction in this community because we all have someone we love who struggles with addiction and it affects us all, right? This idea that the stress is how we're all connected, we all rely on each other, and only when the least of us is taken care of can we all do well as a community. So that was one frame. The next frame that was tested was ingenuity. Ingenuity basically stresses how together we're able to solve problems and that we must solve problems together, right? It poses a challenge for us to take on collectively. And in a way, this is kind of like it's a challenge. It's kind of like a cliffhanger, right? Can we do this? It kind of leaves that question hanging. So the messaging was something like, there has never been a problem that this community hasn't been able to tackle, and we can tackle this addiction problem together too. We can do this, right? We can do this. Teamwork makes the dream work kind of messaging. And the last message that was tested was empathy. And empathy stresses how we must feel for those who are struggling. We must sort of put ourselves in their shoes. We just can't abandon people. So messaging would be something like, people with addiction are people too. There are brothers and sisters, there are sons and daughters, and we can't just leave them to die in the streets. Okay? Let me tell you that the message that resonated the most was interdependence. Interdependence got the most support from the public by far. People felt, yes, that's right, we're a community, we're all connected, we need to do this together. After that came ingenuity as a kind of a distant second. That challenge, right? We can do this together. But the empathy framing decreased the support for the issue by a lot, right? This kind of elicits that stress response that we were talking about before. People don't want to think about what it feels like to be in somebody's shoes who's dealing with addiction and like perhaps going to be dying in the streets. Like they don't want to think about it. They don't want to put themselves on their shoes, and they want to move on and talk about something else. So unfortunately, this organization, about 90% of their materials and their messaging was empathy framed, right? Like no wonder they weren't getting the community support that they were hoping to get, because it was a framing problem. So I see that, Christine, you have your hand up. Let's hear.
Sorry. No, I was just going to, these are great points. I was just going to suggest to everybody that sometimes when we're talking about framing like this, people think it's something new and different or something else they have to learn. But I'd like to encourage everybody here that as you're reading about topics and everything, try to read into that, what kind of frame is being put. Like, so for example, we're seeing a lot of stuff on gun violence, everything. Look at how, in particular, sometimes it's framed around people with mental health and things like that, which is also framing in the sense of discussing mental health in a very negative way, which happens a lot in our research. So I think if you start seeing how people are doing that, or journalists do that and stuff, it can help you kind of see how that's used and how it affects the way people think about things. And I'll be the first to say that the Republicans have long been known for doing this much better than the Democrats do. They have frames and they stick to them and they keep using them over and over. But you can find those in there.
That's a great point, Christine. And yeah, I totally encourage all of you when you're reading an article or when you're looking at some materials to think about, like, take a step back and think, okay, how does this make me feel, right? Am I engaged? Do I want to walk away? Do I want to call and volunteer? Does this make me feel a certain way? Do I feel tender about this? Do I feel angry about this? Do I feel curious about it, right? Because framing is a science, and when we're looking at stuff, when we're reading things, when we're listening to things, we don't even think about it, but the framing is happening in the way that we're responding. So it's a good exercise to take a step back after this training, right? Like, as you're reading stuff, take a step back and just assess how you're feeling, what kind of emotions are elicited, and what kind of response comes out for you when you're looking at reports or advocacy articles or anything like that. Anybody else have any thoughts about framing this far? We're gonna go into our last breakout room here in a minute. We're good? Okay. Okay, so our last breakout room, and I know this has been like a fast flash exercise, so I'm not expecting that anybody's gonna have a polished story that's gonna be ready to go after this training, but it's just sort of giving you the steps and some tools along the way so that you can take this and use it later when you have some time and are actually planning on crafting a story that you're going to use with a community member or an elected official or whatever it may be. So we're going to go back to our small groups, and you're going to polish the story that you've been working on with a specific audience in mind, right? So that you can think about the framing, what they might care about, what they may not care about, and then knowing that what kind of emotion you're hoping to elicit in them. So your audience that you're going to be talking to, you have a meeting with a member of a legislative committee that will be voting on a funding bill for the health councils and the alliance. This elected representative is not a health person, like she doesn't really know very much about public health or public health priorities. She knows very little about what the health councils do. And what you do know about her is that she is from a rural county in southern New Mexico, and that her main issue of interest is economic opportunity for rural New Mexicans, okay? So she cares about job creation, she cares about people being able to afford their homes and, like afford their lives and not live in poverty. So how do you tie this to the work that your health council is doing? How do you tie this to the story that you're trying to share with them? So you'll take a few minutes to polish your story, and you should include the following things in your story. An introduction, very briefly, who you are and what you're there to talk about. Important when you're talking to an elected representative, of course, to share if you are their constituent or not. And if you're not, why should they care about what you're talking about? Then you're gonna have about a minute to actually share your story. What emotions do you want to elicit? How are you framing it? And finally, and almost most importantly, what is the ask, right? When you're talking to somebody like this, you are not just talking to them to talk to them, you want them to do something. So what is it that you're gonna ask them to do? Are you saying, I really would like to invite you to speak in our next health council meeting, or there's a community event that we're having and it would be great if you could be, we'll showcase you and give you an opportunity to share what your priorities are in that event? Or is the ask even just, here's this infographic about what we've talked about, I would love for you to take a look at it. Can I call you in a week to follow up with you? Whatever it is, I want everybody to practice always making an ask. Every time you have a conversation with anybody, a community member, a member of the clergy, a president of an organization, you always, as much as possible, end a conversation with an ask, even if the ask is, can we meet for coffee again in a month, right? So let's go into our breakout rooms. We'll do this last round and then we'll come back to the big room to debrief in a few. So let's do that.
And Sharon, do you have a preference about which room you want to go to? Oh, you're muted.
Anne was saying she thought Southeast might need some support.
Okay, yeah, sure. I think Anne was in Southeast before. They've got a lot of health councils in that room. I'll send you over.
Okay.
think I left too soon.
Mine kicked me out. So, but look, this looks like we're in another small group.
Well, Maureen, we understand why it would kick you out.
Yeah, we're in another small group. Or we're the same ones. I don't know.
This will be, everybody will be back here in just a minute or two. I think some groups might be just finishing up.
We were early.
I did that. And Madeline tells the truth.
Welcome back, everyone. How was that? Let's have a couple of people share. Once you have an audience in mind, does that make everything more difficult? I know from personal experience that we're kind of wired, right? And I am wired this way too. Once I have an audience in mind and that audience is a decision maker, I tend to want to give them a lot of information at the expense of the story, right? So I want to hear from y'all. Was that difficult? How did you do? Were you able to apply some of the things that we've talked about today? Who wants to share?
So I'll start, Maria. So thank you for allowing me to take up so much of the time. But as you probably could see, like with what you just said, I think, was I, and you can be honest, was I giving and providing too much information that made me more hesitant because all of the wheels are spinning? And I talked about like the domino effect of, if we're looking at this, but then there's all of these obstacles. So did I get too heavy into obstacles versus opportunities for completing that
candidly,
story?
right? You're and this is because you think about this all the time. So you're thinking about, so Sophia was talking about how the story something she cares about that her council does is substance abuse programs, right? Like dealing with the substance abuse problem in the county. So, but Sophia, being the advocate that she is, and she thinks about this, is like, okay, well, that's one problem, right? But then we have an education problem. We have a poverty problem. We have a access to a skill training problem. And so it's like, even if you do some work around substance abuse, when you're talking to this representative who cares about economic opportunity, how do you connect the dots, right? So we were able to workshop it so that the substance abuse thing, right? If you don't address substance abuse, kids grow up traumatized, and like they grow up likely to be engaged in substance abuse, likely to be stuck in poverty, likely to not really get the best education they could. This turns out into a bunch of adults that don't have the skills to get good jobs and support their families. This affects the economic growth of our community, right? So those dots were connected, but Sophia knows that there's a lot more to it, right? So then she got into like the thing that is going to stress the person out. When you talk about all the barriers and it's like insurmountable, there's no way that we can address this, then that's going to create a stress response in this, fictional state representative that we're talking to. And she's going to disengage and be like, there's nothing to be done. Like, it's too much. So very good on the connecting the dots between the thing you care about, which is substance abuse in your county, to how that impacts economic opportunity in your county. But then you open the gates, right, to all the different barriers. And that would be too much. That would be something that creates a stress response from the person that you're talking to. Anybody else want to share how that exercise went for you?
I would like to share. I was in the room with Christopher and Kim, and Christopher was basically our spokesperson talking to the representative, and he did really good. He shared his story, and he started off with what his experience was, what he would like to see. And it was really good because, and I've heard him before speak in the group saying that, you know, he's done a lot of speeches and stuff like that, and it really does show with him. He did fantastic. But at one part he's all like, I'm rambling on, I got to stop myself, and he went on to the other side. But it was good, and it was like, you know, he was calm. He kept all his words in order. It was like what the expectations were. He laid down what he wants to see, what he issues he's having, and at the end, he invited to meet 2 weeks later for coffee, and if they wanted more information or if they had any questions on the stories that he shared within like the datas that he gave to the individual. So it was good.
Awesome. And Chris, you are a professional at this, so awesome. Christine says, I would also think that if we generate a stress response in someone, we're asking, and if our ask is only, please fund this, or we need more money, I think this might not convince the other person. Right. So the stress response almost never gets you the outcome that you want, right? Matt says creating good stories and telling them takes practice. Absolutely. And this is why, you know, when we're talking about advocacy, it's so important to think about what I call the inside outside strategy, right? You want to talk to decision makers. You want to talk to people who have a vote that may fund the thing or may pass the bill, but you also really want to get your community to be more aware of what you're working on, what you care about, what's happening in the community. And that's an opportunity to have dozens, hundreds of conversations that are lower stakes conversations with community members that you can really do a lot of practice before you go talk to the, you know, secretary of the department of something, right? Chris, I see your hand up.
Oh, I was going to say one thing that helps before the asks too is if you have something to offer too as well, or you have already piecemeals to the solution that you're working on. Like say it's around funding. If you already have a pot of funding to go with that funding, that makes your ask a lot more easier, and then also a lot more faster, especially with legislators. Because, you know, mine was around housing, and we've been working on this HIA, and we already started looking for money to actually fund a program because that's what we want to do in the end. So even before we're going to legislators or anything about the HIA purpose or the HIA completed or the report pieces and the recommendations, we have those funds already there to make the ask move a little bit faster. So if you have concrete pieces to your solutions to help for your ask, always put those in front of the people that are going to be joining you, because that gives them a little more stability as well too, to go on and trust and everything, if you have it.
That's an excellent point. And anytime that you can showcase your partnerships or how you already have a team of people working on something, you're already moving something, right? That this is not just you begging for something, but you're already working on it. You already have people supporting you. That goes a long way. Mm-hmm. All right, we only have a couple of minutes left, so I want to make sure that if anybody has any questions, any thoughts, anything that you feel that you would like to just add before we close, this would be the time. I want to thank you all for your time and patience and willingness to just really jump into these flash activities that we've done together. Excellent work, everybody.
Thank you.
Love to hear from anybody if you have any feedback or anything you would like to share. Doreen?
Okay, thank you. So quick, our story was about how the health council staff is so stretched, you know, like a staff of one, but with a little amount of funding, you know, how do we advocate for more? So I was just wondering, well, how do we bring in laughter into that story? You know, when you're saying like all the hard things about it, but you want to try and get more funding. How do you bring in that part of the brain chemicals?
So what's coming to mind for me would be something like, you know, we have a staff of one, she's working 60 hours a week. It's intense. And like, you know, like she brings her babies and into work and the meetings, and there's often babies crying and dogs running around, and like, you know, just, I don't know, like something like that, right? So that makes the person more relatable, but also like you have a mental like visualization of just like a chaotic thing that looks kind of like a cartoon going on, and like, you know, just get one laugh out of whoever you're talking to, and then get back to the point that this is not acceptable, right?
Thank you.
Doreen, I don't know if you noticed, but when you said that staff of one, we all giggled and we all smiled. You actually brought out that response in us just by how you said it.
Awesome. So you were able to relate, but the legislators won't.
Well, actually, if I could also, I've looked at a number of the things that the health councils have done. And one of the things you can do in your language is really, it's like I was taught in a resume when you're trying to work on it. Try not to focus as much on the actual work that you do, but any achievements that you have with it. And I think if you could say something like, yes, there's only one person right now, but this is what that one person has managed to do in the year, even if they're small things, and even if it's in, has attended these kinds of trainings on particular capacities so that she can do even more. Just think of what a staff of 3 or 4 could do if we had that also. We tend to, I think in the health councils and elsewhere, not to focus enough on how well we might be doing or the assets, even if they're small, but kind of play them up and then, push for more to go on that.
Christine, yes. And this again is the emotional response that you want to get, right? Like what's going to get a bigger emotional response? Telling somebody an unlikely success story of what somebody was able to do with very little to work with. We all love a story like that, right? Half of the Oscar-winning movies are about this. Versus just saying like, these are the things that we work on and give them a list without any context or any story behind it. Excellent. We have a couple things in the chat.
I was going to say, I like to describe it as doing bake sales for programs. That's what we've done. At first it was bake sales, but at least now those bake sales are making like $100,000 a year. So, that's one way.
Yep. Totally. Well, thank you all so much for attending the meeting today. I hope it's been helpful. The slide deck is going to be shared with you, and there's another slide that we didn't get to that I want to just point out to you so you can look at it later, which is story banking, right? Story banking is just basically making a library of little stories from your community that relate to the issue you're working on. And at the bottom of the slide, you'll see flip.com. It's a great story banking platform. It was made for teachers to use in their classrooms to have the children collect stories for their projects. It's super easy to use, and you can just create like make a link, like you can share that link with people, tell us your story in 30 seconds or in 1 minute. The stories go into this platform and you have them all in one place. You can later put them together into a little video that you can use on social media. You can put them into like a 1 minute collage, if you will, of different stories from different community members that you can share with your legislators. So if you get a chance, just check it out. It's really easy to use. There's support and it's free. That's the best part about it, is that it's completely free. So with that, that was one of the stories that I made using that platform, but we don't have time for this. Thank you all so much. I hope to see you all next month on our next council advocacy training, and go enjoy the rest of your day. Thank you so much.